So great job this week with all of the video submissions. I'm just gonna talk about a few things that I noticed with the submissions this week and then how you can make them even better for next week. So a couple things, when you're gonna explain the manual muscle testing procedure, explain in general the procedures as they were kind of outlined on the PowerPoint that we went through both asynchronously and in our sync session. So one of the things that many of you missed was, at the very beginning of the MMT procedures is explaining to the patient what you're going to be doing, seeking permission, and then potentially asking them to remove an outer layer of clothing in order for you to kind of proceed with your examination. So I want you to go through the whole explanation of what you would do. We're not going to explain it to the patient this week. We're going to do that in subsequent weeks. The other thing to make sure to include in the procedure is you're doing active range of motion first, followed by passive. Some of you reversed that, and maybe that was because that's how they described it on Physio U. But basically, you want the active range of motion first. So I'm going to have Casey go through the active range of motion first because I want to see what her willingness to move is. Then you would describe that you would come in passively and check that range of motion to make sure that what you see is what she actually has. You didn't have to go through all of that last week. Mainly, I wanted you just to describe the procedures. A couple things that are going to be different for this week is when you're doing like a manual muscle test, let's just use last week's example. If you're going to do an MMT of the shoulder abductors, now I want you to actually show me that you know where to palpate middle deltoid, and I want you to show me on video, and you don't have to walk around, but that you know where you would palpate supraspinatus as an example. So this week I actually want you to physically palpate the muscles that you're going to be testing. Same thing goes for goniometry. So if you were to lie down in the supine position, good, and you can just keep filming. Now what I want you to do is actually show me by palpating. Let's lift your head up for 1 second. Very good. I want you to show me where you would palpate, for example, the anterior acromion, midline of the humerus, and then get the patient's permission, but you would be palpating or showing me where the sternum is in order to line up the goniometer, okay? So even though we're not repeating the same sequence that we did last week, I want you to show me where you would palpate the different structures, okay? Okay, sit up again, please. A quick trick for supination this week with a goniometer. In Physio U, they show the big goniometer. If you have a small goniometer in your kit, which I think you do, right? I would like you to use the smaller one because that's the normal convention. So again, you're going to start by describing all of the procedures of the MMT, but it's not specific to just supination, and it's not specific to just the elbow flexion and the wrist extension. I want you to, again, one more time, verbalize all the procedures for the MMT, all the procedures for goniometry in those different sections. But one trick for when you're going to be showing goniometry of supination, keep in mind that the fulcrum is going to have to move closer to that ulnar styloid. It's not going to be able to be here. It actually has to deviate off to the side. So you're going to start with your 0, okay, and then you're going to move your moving arm, and it's going to stay kind of flush here with that proximal portion of the wrist. But then keep in mind that you have to kind of eyeball your stabilizing arm with that midline of the humerus in order to get an accurate measurement for supination. You'll also see it described this way, where we're still parallel to the humerus, but now we're actually kind of heading it down towards the floor instead of up in this direction. So just realize it's going to be described in different ways. I just want you to describe one of those ways, okay? So just want to keep an eye on how you're lining up that goniometer, and then we're just kind of making sure that we're at our end range here. Okay, any other questions about how we should do things for this week? Okay, so that should be helpful as you think about your manual muscle testing procedures and your goniometry. The other thing, you didn't hit stop yet, did you? The other thing for manual muscle testing is this week you're actually going to place the patient in the position of the muscle you're going to test, and you're going to demonstrate where you would stabilize and where you would actually give resistance. You don't actually have to give the resistance, but you're going to show where you would give it in order to maintain your perpendicular pressure. That's it.